Greetings, my name is Michael A. Weiss and I'm the founder and executive director of the Crohn's Disease Warrior Patrol. Welcome to our data bank of video answers for the Crohn's disease, colitis, and inflammatory bowel disease patient. This video answers the question, how to be a Crohn's disease, colitis, or inflammatory bowel disease patient. The answer is 1. Find the right doctor for you. 2. Collaborate with your doctor. 3. Patient engagement. Don't be passive. 4. Organize and collect your medical data. And 5. Learn to be patient and maintain perspective. Number 1. Find the right doctor for you. That doesn't mean it's the best doctor. And I say that because people who love you, once you're diagnosed with Crohn's, colitis, or IBD, they're going to want to help you and do research and say, this is the best doctor in Los Angeles or New York or the Cleveland Clinic or the Mayo Clinic. Wonderful facilities, but you need to find the right doctor for you. What does that mean? You need to find a doctor who's going to manage and treat your disease in sync with the way you want it to be treated. You want to find a doctor who understands your lifestyle so that when he or she prescribes treatments or medications, that is taken into consideration. You may want to find a doctor who's very up on social media so that his or her accessibility is in sync with how you want to access that particular physician. You also may want a doctor who's on the cutting edge of new treatments. You may want a doctor who's open to holistic treatments. 2. Collaborate with your physician. The doctor-patient relationship has substantially changed over the last couple of years, largely due in part to the proliferation of healthcare social media. But you can't forget that there's always a mutual trust, a mutual respect between doctor and patient. But having said that, having a chronic illness is not like being treated for an ailment. You're looking for a physician with whom you could develop a relationship with. So it's more like dating in a way, because you're going to have to deal with this physician and he or she with you over maybe a long period of time. So you have to look at it that way, and you have to make sure that the doctor is willing to listen and collaborate with you. And I think that physician is going to be doing the same when they evaluate you. They want a patient who's going to listen, but also be active and participate in their care. Number 3. Patient engagement. Don't be a passive patient. By this I mean you have to own it. You got to put your name on it, as the comic Jay Moore says. Put your name on it. You now have unfortunately a chronic disease, and you have to learn how to accept that. And accepting that means getting educated. Do what you can, whether it's the internet or through patient support groups or word of mouth. Be an assertive but respectful patient. The more assertive you are, the more input you could give your healthcare providers, the better. And that's why you can't be passive and just let this happen to you. It's a very difficult diagnosis to deal with, particularly if it's a young child, and I'm really talking to parents if that's the case. But you need to embrace it so that you could then be assertive and move forward. Number 4, organize and collect your medical data. Now this is very important. For me, up until mobile phone apps were invented, a scanner was my best friend. And I would scan in my blood reports, my pathology reports, surgical reports. But you need to have everything, because what you want to do is when you see your physician, or if you're rushed into a hospital, you need to have all this information handy, because it will ease your treatment. And with the proliferation of electronic medical records, this sort of sinks in beautifully. Now, there are many health mobile phone applications which will do this going forward. And that's fine too. As long as you can keep all your data on a chip in your phone, that's what you need to do. You need to make your physician's job as easy as possible, because the disease is so complicated that you need to bring something to the table. And what you could bring to the table is the organization of your records. And I mean organized from day one, so that if you're ever on Remicade or Humira or Cimzia, know when you got it, the dose you got it, how many weeks were in between each dosage, etc. This is very important information, and it extends from these biologic drugs to your blood work. Number 5, learn to be patient and always maintain perspective. What I mean by this is, when you're sitting in a doctor's office for a 2 o'clock appointment, and now it's 4 o'clock and you haven't been seen, and someone from their staff says, please be patient, there's been an emergency that the doctor has to handle, learn to accept that. Because when I was 25, I did not, until someone very wisely said to me, Michael, One day that emergency is going to be you, so please be patient. Now that's exactly what happened. I hope it doesn't happen to you, but it gave me great perspective. And that perspective helps me get through many, many difficult times, as it will you. You can support the Crohn's Disease Warrior Patrol in the following ways. 1. You can back the Crohn's Disease Warrior Patrol project at the website medstarter.com. At medstarter.com, you can buy a $25 CDWP t-shirt and or donate any sum of money for a variety of rewards. 2. You can sign up to be a patient warrior or a patient in need at Crohn'sDiseaseWarriorPatrol.org. Or 3. You can share this video and or the medstarter.com CDWP project on social media.